Okay, I think we're ready to go. Hello, everybody. My name is Kathy Thompson. I'm the Medicare account executive, a Medicare account executive with Welsh Duffield. Thank you for joining us for today's webinar, Demystifying Medicare, presented by my colleague, Paula Vinay. This webinar is the last in Welsh Duffield's summer school series, and we thank you for joining us all month as we discussed key issues in HR and employee benefits. If you're interested in watching any of the webinar replays, visit welshduffield.com/summer school. Before I introduce Paula, I'd just like to cover a few housekeeping items. Today's webinar is being recorded. We will share a link with you after the event along with the presentation slides. This presentation is approved for 1 SHRM professional development credit and 1 business recertification credit hour through HRCI. We'll email the code needed for these credits to live attendees after the webinar. We invite your comments and questions. Please use the Q&A box on your screen. If you think of a question at any point, just type it in there and we'll hold off until the discussion portion at the end of the event. And with that, I'm happy to introduce today's presenter. Paula Vinay is a Medicare and individual benefits consultant here at Welsh Duffield. She's been with us for a little over a year and has joined us after 10 years at Blue Cross and Blue Shield. And I'm happy to say I've worked with Paula for most of those 10 years in one capacity or another. Which at Blue Cross Blue Shield, she assisted Medicare New York State health clients and hosted educational networking events within the community. Paula's main focus at Welsh Duffield is on advising, selling, and enrolling Medicare Advantage, Medicare Supplement, prescription drug plan, and other ancillary insurance products to clients in Western New York. In addition, Paula is an active board member for the network and aging. If you ask your employees the first word that comes to mind when you say Medicare, they'll probably say confusing. Many Americans work beyond their 65th birthday. And there are eligibility rules and requirements around Medicare that vary depending on the factors like the size of the company and whether they participate in an HSA. Today, we'll be looking to Paula to take some of the mystery out of all of those questions and out of Medicare in general, and provide guidance for you to make sense of this challenging topic. At this time, I'm going to hand the floor over to Paula, who's going to start today's presentation.
Thank you, Kathy. Good morning, everybody. Thank you so much for being with us. Hopefully this will be educational and interesting for you. As Kathy said, my main focus is working one-on-one with clients who are either aging into Medicare, becoming Medicare eligible due to disability, or looking to retire. But our focus today is more about how employers can handle the questions that come when somebody is becoming Medicare eligible or thinking about retirement. So today we're going to cover some topics such as defining what Medicare is, how you can give assistance to your active employees and their spouses. We're going to go through the parts of Medicare, focusing primarily on Part A, Part B, and Part D. There is a Part C that we will address a little bit, but these are the main focus for somebody who is employed. We'll talk about enrolling in Medicare at retirement time, how we at Welsh Duffield can be of assistance to your company and to your employees. And of course, as Kathy said, we'll have a little bit of Q&A at the end as well. So, defining Medicare. Now, you've probably heard on the radio, on TV, companies offering to make Medicare easy because, you know, and I laugh. And it's very funny because Medicare is a bit complicated. And my goal when I'm meeting with folks is always to try to keep it as painless as possible, but it can be very confusing. So we're going to start with the very basics here, starting off with what Medicare is. So Medicare is health insurance, mostly for folks who are age 65 or older, although there are people under the age of 65 who qualify for Medicare based on certain disabilities. If they are certified disabled and receiving Social Security disability, you become, well, go back, sorry. Why does it do that to me? Back to, please. Thank you. When you become Medicare eligible on the 25th month of being certified disabled and collecting Social Security disability, that's one window of opportunity to become Medicare eligible. Folks who are diagnosed with ALS or Lou Gehrig's disease, there is no waiting period on that. You will automatically become eligible for Medicare. And also folks who have end-stage renal disease, which means they are in kidney failure and receiving dialysis. They also have a special window of eligibility to take advantage of Medicare. You do have to be a US citizen or lawfully present in the US to be eligible for Medicare. So when people start getting inundated with information in the mail, on the television, the way to tell, and if somebody is coming to you and saying, I'm getting all this stuff, I'm getting inundated with information, and this person wants me to call them and send this card back. The thing that you can advise to be very helpful is to keep an eye out for these 3 logos. So if something is officially coming from the government, it should either be coming with the Social Security logo, the RRB or Railroad Retirement Board logo, or the CMS logo. Enrollment in Medicare is actually done through Social Security or the RRB when you're initially enrolled. They'll handle sending replacement ID cards and things like that. The initial welcome packet to Medicare, that's coming from Social Security or the RRB. Everything else, once somebody is enrolled in Medicare, is handled by CMS. CMS is the regulatory agency that handles things like creditable drug coverage and what Medicare Advantage plans are available and what the costs are and things like that. Everything else that folks are receiving is probably a solicitation for their business. It looks very official, but people have to be very cautious with it. There are 4 parts of Medicare. Original Medicare, A and B, the red, white, and blue Medicare card that folks get in the mail when they first enroll. Part A is the hospital insurance. Part B is medical insurance. There are also parts C and D of Medicare. Part C is a Medicare Advantage plan. It's an interchangeable term. And when we get around October, you'll see a lot of advertising for Medicare Advantage plans. You'll see 0 premium plans and this benefit and that benefit. Part D of Medicare is the drug coverage. Easy to remember, D for drug. So with original Medicare A and B, those are managed by the government as far as the enrollment and administering of those parts. Parts C and D are offered through private insurance companies. So your Independent Health, your United and Aetna and Blue Cross Blue Shield. They offer the Medicare Advantage plans and also the Part D prescription plans. So if you have an employee who is approaching 65, getting ready for their Medicare eligibility, here's some things you want to know. Part A of Medicare is the hospital coverage. Part A covers inpatient services, skilled nursing, hospice, blood that you receive while an inpatient. And for most people, there's no cost to Medicare Part A because they've been paying into it for their working career through FICA taxes. So as long as they have the appropriate work history, either under their own employment or their spouse's employment, they can get Medicare Part A for free. Some people are automatically enrolled in Part A of Medicare, and there's a lot of confusion about that, about, well, I thought I just get Medicare. Don't I just get Medicare when I turn 65? Not necessarily. People are automatically enrolled in Medicare Part A and B if they are collecting Social Security or Railroad Retirement Board benefits. That's when the automatic enrollment happens. And those folks will get a packet about 3 months before their 65th birthday. It's a little larger than letter size from Social Security. Unfortunately, a lot of people, because they're getting so inundated with mail, they chuck it. They don't realize that it's an official document. So again, if you're talking to somebody, tell them to keep an eye out for that Social Security return address because they're getting their official Medicare welcome packet. Employees, if they are not collecting Social Security, can elect to enroll in Part A if they choose to. Again, there's no cost to it. However, this is a word of caution. If somebody's calling Social Security and asking about it, Social Security is not necessarily telling them that there are any pitfalls with enrolling in Part A. They'll just say, yeah, go ahead, enroll in Part A. If they are contributing to an HSA, they have an HSA account, if they're going to be actively working and want to continue contributing to the HSA, you cannot have any part of Medicare. So when you're having those conversations and an HSA is involved, if they are not collecting Social Security, I would advise against enrollment in Part A, even though there's no cost to it. If you are a large employer, over 20 employees, Medicare is just a secondary insurance anyway, so it's not doing anything for them, just sitting there as a secondary insurance. So talking a little bit about the HSA and Medicare, a lot of confusion, a lot of misinformation about how HSAs work with Medicare eligibility. So obviously, if you're familiar with HSAs, you know the money in an HSA account belongs to the person assigned to it, and they can use the money in an HSA forever until it runs out. As far as contributing to an HSA, though, you can't contribute if you have Medicare A or B. So, as I mentioned, be very careful when having those conversations with Social Security, or if one of your employees says, well, you know, my brother told me I should sign up for Part A because there's no cost and I need to do that. Definitely warn against it if contributing to an HSA. And if they are considering retirement, this last bullet point is very important. If you're retiring past the age of 65 and enrolling new into Medicare A and B, Part A of Medicare will backdate 6 months. So your employee will want to stop any contributions to the HSA 6 months prior to enrollment in the Medicare, because they're going to backdate the Part A. So a little known thing that pops up where you can get into kind of a sticky situation if somebody is still having money deposited into the HSA and then picking up Medicare. So keep that in mind. So Part B of Medicare. So Part A is hospital coverage, Part B is medical coverage. Part B of Medicare covers things like doctor visits and outpatient procedures, chemotherapy drugs, physical therapy, blood work. All of that stuff is covered under Part B of Medicare. Preventive services also covered under Medicare Part B. For most people, Medicare Part B comes with a monthly cost of $170.10 a month in 2022. Now, not everybody pays that amount. If you have a very high income, you actually pay more for Part B. It's called an IRMA, which is an income-related monthly adjustment amount. Folks with a very low income may actually have their Medicare Part B covered by the government. But most people are paying that standard amount of $170.10 a month. If you are collecting Social Security, that amount is automatically withdrawn from the Social Security amount. If you are not collecting Social Security, somebody who's enrolling in Part B will be billed quarterly for the Part B premium. The rules with Part B enrollment are different depending on the size of your group, of your employment group, okay? If we're talking about a large group with 20 or more employees, and keep in mind that what we're talking about is the number of employees, not the number of people who are participating in the medical plan with your group, just your overall employee role, more about your payroll. So if you're a large employer, Medicare Part B isn't automatic again if you're collecting Social Security, but you're given the option of deferring your Part B because your group plan, your employment plan is your primary payer. Again, with Medicare being a secondary payer, it's not doing you a lot of good and you're going to start paying that Part B premium. So for most people, when you're a large group, you're going to mail back that Medicare card, and there's instructions right in the enrollment packet, the Welcome to Medicare packet, on how to defer your Part B. So you just basically mail it back to Social Security. They issue a new card that just shows Medicare Part A. That's for the folks who are collecting Social Security. Now, the rule is a little bit different if somebody's becoming Medicare eligible due to disability. Okay, the group size changes. So for somebody aging into Medicare, your group plan is the primary payer if you have 20 or more employees. If you're becoming Medicare eligible due to disability, the group size has to be 100 or more. And believe me, I've seen some issues where people were misinformed about that, just didn't know that the rule was different for disability and wound up with claims that didn't get paid because they were supposed to enroll in the Medicare Part B based on the group size. If somebody misses the deadline to turn down their Part B during their initial coverage election period, which is a 7-month window around their 65th birthday, or if they, let's say they retire, but then they come back to work to a group that has employer benefits, you can turn off the Part B one time. So there's a special form that needs to be submitted to Social Security saying, okay, I've had Part B, I've been paying into Part B, but I want to turn it off because I have a new employment situation. But you can only do it once and then pick Part B back up again upon another retirement date. For small groups, under 20 employees, rules are different. You do need to pick up Medicare A and B because Medicare is the primary payer of your claims. I can't tell you how many times working at Blue Cross Blue Shield, I had those conversations with people because we would reach out proactively and say, hey, you're enrolled in one of our group plans. We see you're becoming Medicare eligible. Do you have questions about that? Because you need to get your A and B in place. And people are delaying their Social Security a lot. You know, they're not enrolling in their Social Security benefits until sometimes, you know, their late 60s, early 70s. So you do have to proactively enroll in A and B of Medicare because Medicare is going to be the primary payer of the claims. This is not something that makes people very happy because if you're actively working and you've got employer coverage and you're contributing to it out of your paycheck, you know, your employer's paying part, you're paying part, and then you've got to pay that Part B premium on top of it, it can lead to a little bit of tension. But this is the reason why you have to do it, is because Medicare is going to be the primary payer on your claims. And even though you're not going to get a penalty, so you hear about late enrollment penalties with Part B, you're not accruing a penalty. Your employees aren't accruing a penalty for not picking up Part B. The problem is pending claims. And it sometimes takes the insurance carriers a little bit of time to catch up with the fact that they've been paying on claims that they shouldn't. I worked with a client just a couple of months ago. Their wife got socked with huge bills because she did not enroll in Medicare Part B while she was covered under her husband's plan. Medicare was supposed to be the primary payer, didn't catch up with them for several months, and then suddenly, boom, they're being back billed for all of these claims. So a very important piece of guidance when you are a smaller employer, you've got to encourage people to take their Medicare B, okay? So working with carriers, there are letters that they send out. I know Blue Cross Blue Shield would do this about 60 days before an employee was turning 65. They would mail out 2 letters, one to the employer, one to the employee, saying, hey, you're approaching your 65th birthday. Tell us about your Medicare, because we need to know who's paying first on your claims. So they're going to ask the employer to verify the size of the group and what arrangements they have as far as the medical coverage is being provided. The letter that goes to the employee is going to ask them to provide their MBI, their Medicare number, and effective dates of Part A and B. So if it's a larger group and you get that Medicare certification letter, it's very important as the employer that you're reporting the correct group size to the carrier so they know who they're billing first. And I'm sure you can tell, you know, as your workforce changes and maybe you're hovering around that 20 employee threshold, it's really important to stay on top of reporting that, because the last thing I'm sure you want to do is leave your employees in the lurch where they're getting, you know, oh, we've dipped below 20 and now Medicare is supposed to be the primary payer. If they are over, you know, well over 20 employees and definitely deferring their Medicare benefits, you can tell them when they receive their Medicare certification letter, just to indicate on their, you know, actively working, the group is over 20, I'm deferring my Medicare. Okay. So as you see on that, that third bullet point, some research I was doing, it's spelled out pretty clearly that it is the employer's responsibility to inform the third-party administrator or the insurance carrier of the proper employee count for the purposes of determining who pays first. A very important thing to pay attention to. So Medicare drug coverage. Again, easy to remember, Part D for drug. When you become Medicare eligible, since 2006, all Medicare beneficiaries are required to carry creditable drug coverage. This is a little pet peeve of mine. It's creditable coverage, not credible coverage. It's not believable coverage. It's coverage for which you're getting credit. Okay. Part D has to be creditable, which means that it's at least as good or better than what the Medicare standard Part D plan offers. So if your employer-based plan is not creditable, your employee risks getting a late enrollment penalty. So it's important that you advise your employees if the plan they are enrolling in is creditable drug coverage. And there are those creditable drug coverage letters we're going to talk about in a little bit. But when those are sent out to the employees, if they're looking to you for guidance, please advise them to hang on to their certificate of creditable coverage letter, because they may need to produce that for enrollment in a Part D plan to prove that they have had creditable drug coverage and will not face a late enrollment penalty after they drop employer plans and pick up a Medicare drug plan. Very, very important. So the proof of creditable coverage letter. According to CMS, the Centers for Medicare and Medicaid Services, entities that provide prescription drug coverage to Medicare Part D eligible individuals must notify these individuals whether the drug coverage they have is creditable or non-creditable. We were doing a presentation just last week, and we were at an employer and their HR person was in there, and we kind of addressed this, and we're talking about those creditable coverage letters, and the employer was like, we're supposed to send those? Like there's a lot of confusion as who's responsible for sending those creditable coverage letters out. Per CMS, it is the employer's responsibility to notify your employees if the drug coverage is creditable. You're also supposed to report to CMS what drug plans you're offering and which ones are creditable and non-creditable. I found a really good resource on CMS that you can link here through the presentation on some model language that you can use to create those creditable coverage letters. Very, very important for the sake of your employees that you communicate to them if their coverage is creditable and how they can verify that their coverage is creditable and prove it down the line. So again, we talked a little bit about the parts of Medicare, original Medicare A and B, administered by the government, Medicare Part C, otherwise known as the Medicare Advantage plans, interchangeable term, and the Part D, Medicare prescription drug coverage offered through your private insurance company. Now, some companies offer their retirees Medicare Advantage plans, Part C plans. You may hear them referred to as EGWIP, employer group waiver plans. So some employees may be eligible for the Medicare Advantage plans through the employer. And most of your Part C plans usually have the Part D, the drug coverage, built right into them. Just a little information on what Part A covers and what Part A costs. If somebody is looking to retire and trying to get a better understanding of what costs they might incur just being under original Medicare A and B, we broke out some of those costs for you to be able to communicate. Again, premium free, but if somebody is admitted to the hospital, there are some pretty large out-of-pocket costs under Medicare Part A. With Part B, you'll hear a lot about 20%. You're responsible for 20%. So not only is somebody paying the standard premium of $170.10 a month with Medicare Part B, if they don't have any other coverage filling in what Medicare doesn't, they're going to pay a deductible one time per year of $233. Plus any other medical services, they're going to pay 20% of what they're having done. Not only that, as I mentioned, there is that income-related monthly adjustment amount for higher wage earners. That income-related monthly adjustment amount is actually based on somebody's income from 2 years prior. So if they're looking to retire and their income is going to be quite a bit lower at retirement, Medicare is looking at their income from 2 years ago to determine if they're subject to the IRMAA. A little more information on the IRMAA on the right column there. Not only is there an IRMAA for Part B, but there's also an IRMAA for Part D. So, you know, if your executives have, you know, been very successful, they will be summarily punished for that by doing a Part B and a Part D IRMAA. There's a little example there at the bottom. So a single person with income over $91,000 in 2020 is going to pay not $170.10 for their Part B. They'll actually pay $238.10. And that goes up. It's a sliding scale as the income increases and tops out at about $500,000 in earnings, where Medicare Part B costs well over $400 a month. The Part B late enrollment penalty, we hope nobody ever has to deal with this, but if they didn't pick up Part B upon retirement, when they no longer had employer coverage available, or if somebody was enrolled through the New York State Marketplace, for example, if you had part-time workers who were enrolled through the Marketplace and didn't pick up their Part B when they should have, they could be incurring a 10% late enrollment penalty for every year they go without Part B when they are eligible to do it. So when it comes time for applying for Medicare, as we mentioned, if somebody is already actively collecting Social Security or railroad retirement benefits, say that 10 times fast, they will automatically get their Medicare enrollment packet in the mail, with the option to decline Part B if they're going to be actively working and the group is over 20. If they are not automatically enrolled in Medicare, in particular of concern for the folks who are working for the smaller groups, they need to take action and enroll in their Medicare A and B. The easiest way to do that is at socialsecurity.gov. Right on the home screen, there's a box that says Medicare with a cute picture. They can click on that. If they don't want to pick up their Social Security benefits, it's fine. They can just enroll in Medicare Part A and B online. It's very straightforward. They're simply going to ask, are you enrolling in Medicare only? Yes. What's your group? You know, are you actively working? So retiring at 65 or later, if somebody never picked up their Part A or B of Medicare, again, they can enroll through Medicare.gov and apply for their A and B. They have to end their HSA contributions, as we mentioned. If you're over the age of 65, stop the HSA contributions 6 months prior to retirement. If there are retiree plans available, of course, you're going to have that conversation with them. If you're offering, you know, a Medicare Advantage group plan, a Medicare Supplement group plan, or different retiree coverage, have that explanation. If there are no retiree plans available, and they're becoming less and less common, let's face it, most people are going to be on their own when they retire. They can contact us for guidance on what plan options are available based on their needs. We'll talk a little bit about our services in a moment. Of course, you want to keep in mind that there are spouses and dependent children who may be affected by a decision to retire. There are options available, of course, through COBRA. There's certain rules about COBRA when you have Medicare eligibility. There are also plans through the New York State Marketplace. And as Kathy mentioned at the top, I work on both ends of the spectrum. So if somebody is becoming Medicare eligible, but their spouse isn't quite 65 yet, or they have a dependent child who's turning 26 and losing coverage on their plans, I can certainly be of assistance on both fronts there. This is just a little sample of screenshots on the online application for Medicare. They boast that it is very easy. I have watched a couple of folks do their the online application for Medicare. It really is pretty straightforward. They're going to ask very specific questions about, are you working? Has your coverage already ended? That sort of thing. It does take a few weeks to process. So I have a gentleman who's aging into Medicare in August. He started his online application at the end of, well, actually mid-May, mid to end of May, still hasn't gone through. And they say it takes 2 to 4 weeks. It's been like 6 now, and he's still waiting. So definitely want to get the ball rolling as early as possible within that initial coverage election period. If somebody's retiring and they had Part A, but they just need to pick up Part B, that can be done online. That was introduced during the pandemic, although I do think that the paperwork is a more straightforward approach to picking up Part B. So you may have folks coming to you with a form that you need to fill out for them. So there are 2 forms that are submitted when applying for Part B only. There's an application for enrollment in Part B that the employee is going to fill out either for themselves or for their spouse if they've been covered under the group plan for the spouse. And there's a request for employment information as well. Very important, again, if you can provide a little bit of guidance for somebody who's applying for their Medicare B alone and they have those forms. On the application for enrollment in Part B, there is a remarks section. It's section 12. Really important in that section that the applicant fills in the date that they want their Medicare B to start. Our general guidance is to start this ball rolling about 60 days before you need your Part B in place. So let's say I want to retire in October and I'm starting that application at the beginning of August. I want to indicate in the remarks section that I'm requesting an effective date of October 1st for my Medicare Part B. If you don't put that in there, they're going to give you the first available effective date, which could be September, which could lead to a lot of confusion and a month of Part B premium being paid unnecessarily. On the request for employment information form, the employee is going to fill out the top section just about, who they are, their address, and then you will fill out the bottom section, which confirms that the person has been enrolled in group coverage, whether or not the coverage has already ended, the date that they first were enrolled in that plan, and the date that it's going to be ending. Again, very important that you help your folks out getting those forms because they need to be submitted together for the application for Part B to be processed correctly. How can we help? Well, so there are 2 options for your retirees or people who are opting out of the employer plan. There are people who continue actively working and decide if they're in a high deductible plan and they've got to pay your Part B premium, sometimes it's really just more affordable to go the route of a Medicare plan and dropping the group plan. So it's something you definitely want to offer as an option and explore. So there are Medicare supplement plans, also known as Medigap plans. With that, original Medicare remains the person's primary coverage and the Medigap fills in the gaps of original Medicare. Those plans tend to be a little more expensive, But they do offer some wonderful benefits, such as being able to see any doctor across the country that accepts Medicare, and you're paying a very predictable monthly premium where you're not really dealing with co-pays and co-insurances as you use your insurance. Now, those plans do not include drug coverage. So if somebody wants to go that route, they're going to pay their Part B premium. They're going to pay the premium for their Medicare supplement plan, and they'll pay a premium to pick up a drug plan as well. A lot of options there, but generally, there's specific people who are a better fit for that kind of plan. Where in Western New York in particular, people tend to gravitate more toward the Medicare Advantage plans. Medicare Advantage, also known as Medicare Part C, those plans become an umbrella over the A, the B, and most of the time, the D, the drug is built right into them. With that, a person can take their Medicare card, tuck it away someplace safe. They're just going to show their Medicare Advantage card when they go to the doctor or go to the hospital, pick up a prescription. So what we can do, and what we love doing, is coming out to your businesses, and we can do presentations right to your employees to help clarify some of these confusing scenarios and making your life a little easier by helping out with those questions that people come to you. We are happy to come to your site, to your location, to do a presentation. We also offer them virtually as well. We also, of course, will meet with your folks one-on-one, and we try to make that as seamless as possible. We, of course, have our wonderful downtown office at 801 Main. We can meet at your office if you have a quiet space where we can sit down with employees and schedule appointments. We do, in some instances, do home visits or meet out at a neutral location. So this is at no cost. Your employees have access to our services. It's a complimentary service that we offer. We will review their individual situations, their list of prescriptions, the doctors they're seeing, and help advise them on what plans might be the best fit. We can help guide them through the enrollment process in the Medicare plans and offer support answering their questions along the way. These are the different plans that we are certified with to offer. You'll see names I'm sure you recognize, of course, Blue Cross Blue Shield, now Highmark, WellCare, Independent Health, Excellus, Univera. We're able to do an impartial shop for the plans that are going to meet each individual's needs. And this is us. So if you have any questions, we're certainly going to have a little bit of time. I don't even know what time it is. We're doing pretty well, I guess. Have some time for question and answer here, but if any follow-up questions need to be addressed, or if you have folks who would like to schedule a consultation or bring us into your offices to present, please reach out. We're very happy to help. And as Kathy mentioned, we've been working together for many, many years, and we're a good team. So we love doing this together.
It's
A
wonderful.
couple resources here. Oh, sorry, Kathy.
Oh, no, that's okay.
Resources here. Just if you need more information, if you're curious about the different forms that are available through CMS, I find the CMS website very easily searched. Just throw in a keyword or two and you're going to have access to different forms, documents, regulations, guidance, and things like that available to you. If your employees or your parents or your grandparents or anybody needs assistance with their individual Medicare questions, Medicare.gov is actually laid out pretty darn well. It's very user-friendly and a lot of good information for individuals available at Medicare.gov. And now it's time for questions.
Okay, thank you, Paula. That's great information. And we do have several questions that have been submitted by the audience as you've been talking, and we're accumulating more. So I'm going to launch right into them.
All right.
The first one goes back to the subject of HSAs, which we get a lot of questions on. What happens if an HSA fund continue when the employees are enrolled in Medicare? Are there penalties? I think they're referring to the contributions.
Right.
I'm going to make that project. That's what's being asked.
Yeah, so if I'm not mistaken, I think any contributions that are made after you are no longer eligible, that money can't stay in the account. It has to come out, and I believe there are penalties involved. Kim, our manager here, Kim is here as another resource for information across the table from me. But there are implications. It's not going to go without, a slap on the wrist. As far as how a penalty is assessed, I'm not 100% sure on that, but I'd be happy to look into it and get back to you. Kathy has disappeared.
Oh, thanks.
Back. Hello.
All right, we're back. All right. I do have another one. Can we have a copy of the PowerPoint presentation? And we are sharing that, I think, at the end, correct?
Yeah, I believe a link to the recording of the session will be made available as well. And if I believe we can attach a copy of the slide deck with that.
Okay, great. Another one, is it possible enrolling in Medicare and picking up a supplementary plan is more advantageous than remaining in the employer group plan? And I think you addressed that a little bit.
Yeah, right at the end, I think I threw that in. Yeah, sometimes it certainly is more advantageous. This is where you really want to sit down with somebody one-on-one, and we would like to do that for them, because a lot of it comes into whether or not they're going to be assessed the IRMA. So they may not be aware of the fact that they're going to pay more for their Medicare Part B. If they're paying for Part B and the group is under 20 and they're paying for it anyway, yeah, sometimes it really does make a lot more sense to drop the group plan, especially if you're in a high deductible plan, because you're going to be paying, out of pocket for quite a bit of your expenses. And there are some very affordable Medicare plans out there that could be a better way to go. Absolutely.
Okay, another one, this is something that goes outside of Medicare a little bit, but what if an employee retires prior to the age of 65, so not yet Medicare eligible due to even disability? What advice should we be providing the employee?
So again, and this is something that I've been seeing more and more of. We've heard of, I'm sure, about the Great Resignation. A lot of folks are deciding that they're going to retire even when they're not Medicare eligible and want to explore options. Of course, COBRA might be a solution, but more often than not, going the route of a New York State Marketplace plan is the way to go. So I'm very happy to work with folks exploring those possibilities. And if you're not real familiar with the Marketplace, there's a lot of financial assistance available based on somebody's projected gross income for the year that they're applying. So I can walk them through that application process and see, is there any financial assistance available? There are a wide range of plans available on the Marketplace. So that is definitely something I do almost every day, working with folks who are in exactly that situation.
Great, thanks, Paula. Then we have another one. What is the best way to verify group size on the employer certification letters if you are an employer hovering around 20 employees but face regular turnover?
Yeah. Kim, do you have some guidance on that? Because I really, there is language on the CMS site that talks about when to verify and how often you need to verify. It is tricky. I'm not going to lie, but I would say going to CMS, there is guidance on how to account for the number of employees you have, and you're also taking into consideration part-time employees as well. So there's definitely language out there to provide you guidance, and I would say your best starting point is CMS and putting in the search verifying employer size.
Great. Okay, and here's another one on the look back period. So can you confirm that the look back period for HSA does not apply to anyone who is just now turning 65? So they do not need to worry about that in advance, like folks who enroll after they are 65, which is correct.
That's correct. Yeah. So that 6-month backdating, that only comes into effect for people who are past the age of 65 and looking to enroll newly into their Medicare benefits.
Okay, and I've got one on an HRA here. So the question is, can an employer contribute on behalf of an employee who is on Medicare A and B to a health reimbursement account, an HRA? Which
Yes, you can.
yes, it can.
Yep.
Right.
Totally
And-
different animal.
Right, exactly. And there was another question actually in the chat section that asked the same thing. So there were two on that subject there.
Okay.
And let's see. See if I skipped anything here. Okay, I think we've got them all at this.
Great questions.
Yes, super questions. Okay. Nothing more from the audience? Okay. All right. So I want to thank you. We want to thank everyone who joined us for today's webinar. Paula, as always, really appreciate sharing your expertise and your insights into this very complicated subject. We hope you enjoyed this presentation. And again, thank you for participating in our summer school webinar series. If you have additional questions or want to connect directly with our Walsh Sheffield Medicare team, just feel free to reach out using the contact information on the screen. And we're happy to sit down with you, sit down with employees, whatever works for you. Thank you again for joining us today and enjoy the rest of your day.
Thanks, everyone.